Infodemic Management pillar for the World Health Organization's response to COVID-19. Welcome today. We're glad that you've joined us for the first of two sessions of the Media and Journalism track for WHO's third virtual Global Infodemic Management Conference. Before I go any further, I have to stop and thank our incredible partners in this endeavor, BBC Media Action and Internews. The vision of this conference is to identify concrete problems and solutions that we will, as a whole of society, commit to addressing. So we focus the entire conference on 6 stakeholder groups that can provide immediate impact on addressing infodemics. And what do we consider infodemics? Well, at WHO, we define it as the overwhelming amount of information that makes it difficult for individuals to make choices about their health, primarily during a public health event, an acute event like COVID-19. So with this conference, we're looking at 6 different sectors. The science and research community, number 1, ministries of health and public health institutions, technology companies and social media platforms, UN organizations and multilaterals, NGOs and civil society groups, and finally, the 6th group, and most importantly, journalists and media organizations. So that's you. Thanks for joining, because you're going to really help us look at both what we've learned over the past year in terms of lessons learned and challenges that we faced in reporting and getting the information you needed as journalists to report the COVID-19 pandemic. And also later, next week, on December 9th, we'll have the same session, but looking more at solutions and commitment to the future. So today's session is called The Challenge, Infodemics in the Media, Learning from the Past. We'll have an open discussion, which is a little less structured, and we're going to hear different perspectives from 4 different experts around the world about how infodemic affected the way they worked over the past year. Following this, after 1 hour, we're going to have a series of breakout cafes that some of you, but unfortunately not all of you, have been invited to. We had a number of different registrants for the workshop today, but only were able to invite a number of people, certain smaller number of people, into cafe breakout sessions to have a more in-depth conversation. And we had to keep those numbers kind of small so that we could hear from many different voices. But following this, we will share all of the information that was discussed and give you a moment, give you a chance to provide some feedback from that. Our next program, again, will be a week from today on December 9th, where we'll take the consensus that was discussed today and take that information and then move forward with solutions and a commitment for the way forward for the next infodemic. Because like epidemics and pandemics, there's always going to be a next one. So these solutions that we'll talk about next week may come in the form of tools, training, so on. But just to let you know that there will be tangible outcomes from this. We'll work together with our partners like BBC Media Action and Internews through a joint mechanism called the Collective Service. This is where WHO, UNICEF, and International Federation of the Red Cross have joined together in part of a response to this and future emergencies, and we're working together with a number of partners around the world. So in this, we have a media working group with BBC Media Action and Internews, where we'll work on these tangible products, outputs of these sessions. So with that, let me turn it over to our moderator for the roundtable discussion, Ida Joost, who is the Global Health Media Advisor for Internews. Ida?
Thank you so much, Mindy. Wonderful. This is a fantastic, diverse group of speakers from very many different focus areas and geographic areas around the world. I'm going to very briefly introduce them all to you, but I will actually ask all of them to, in fact, introduce themselves as well. So we have Hussein Al-Sharif, who's in Lebanon. He is with the Maharat Foundation, where he is doing fact-checking. We've all seen the rise of fact-checking as a career, as a incredibly important endeavor in these times. We have Imogen Folks, who's based in Geneva for the BBC. I'll ask her to introduce herself some more a bit later as well. And we have Asha Mwilu. She's in Kenya. I used to follow her as a mainstream media reporter, but in pandemic times, she formed Debunked Media at a time when many other journalists said, hold on, we've got to hold on to our jobs. The media industry is collapsing. She formed a new media startup, which is fabulous. And we have, talking from India, Sainath, P. Sainath, as he's known, who has formed the Rural Archive of India, and just an incredible and incredibly unique online collective of storytelling, really literally putting rural India on the map. So before we get into kind of all these challenges that Mindy has just mentioned, I want us to go to all of you panelists and ask you, tell us about the work you do. Tell us about what it is that you do, not necessarily yet, what you feel about the infodemic, the abundance of information, about all the misinformation. Just put us in the picture. What do you do? Let's start with Hussein.
Hi everybody. I want to thank basically Internews and WHO and BBC Media Action for this opportunity. Actually, in Maharat Foundation, we work on, we have a platform, fact-checking platform with Maharat News, and we tackle all the information or misinformation about the pandemic in the last year. So we have a lot of infodemic misinformation and disinformation spread on social media. We tackle them and we spread the actual and the truth information on the social media to tackle the infodemic. So that's basically what we do, especially related to COVID-19.
Thanks, Hussein. Sanath, tell us what you do.
I run a website called the People's Archive of Rural India, which is wholly dedicated to covering the everyday lives of everyday people in the 833 million human beings who live in rural India. And we had to do, we were the only ones who would be able to cover the migrants. As you know, there was a gigantic reverse migration in India, as more than, in my opinion, not less than 20 million people returned from the cities and towns and other villages where they were towards their homes in the hope of survival. So that was one thing. And the second was that we reported from about 35 different regions, and several of our reporters also came down with COVID, but we were anyway positioned in those areas. I think that we experienced and found and still find in the Indian media, mainstream or more correctly, corporate media, both misinformation and disinformation. The second of a very either a commercial nature or really vicious minority baiting. Really vicious minority baiting. For just to give you one example, in India, as you know, declared officially a pandemic very late, as late as, much later, because we were waiting for President Trump's visit to get over before we could do that. Yeah, so that was the reason. But a religious meeting of a sect of Muslims was retrospectively declared to have been the super spreader in Delhi when the country had not even officially declared a pandemic at that stage. Yeah. And much larger meetings of other religious groups were held, maybe 40, 50 times that size, which were never stigmatized in that way.
That's incredible.
So that was something really difficult to deal with.
Absolutely. I'd love to talk to ask you to talk more about that in a moment. And want to ask you, Asha, explain to us what it is that you do. You have a startup.
Yeah, I do run a startup based in Nairobi. It's called Debunked Media. I've spent more than 10 years in mainstream television in Kenya, primarily doing investigative TV documentaries. And I launched Debunked Media in the middle of the pandemic. We're a platform. We use audio, visual, and interactive pieces on the digital platforms driven by social media to explain big events to young audiences, to young people. So this is 18 years to primarily 18 to 35. And we use a lot of data analysis, fact checking, and then we use storytelling to explain very complex issues to our young audiences. And competing with social media and all the fake news, misinformation on the online space. So the pandemic was just a brilliant time to launch something like this and to test how people would receive good content that's well fact checked.
Wonderful, thank you. Imogen, when I heard that you're based in Geneva, I was just trying to imagine what it's like to be a correspondent sort of literally at the heart of where, the response to the pandemic is being managed from by the WHO. So tell us more about what you do, please.
Well, I mean, I'm the BBC's Geneva correspondent, so I cover, of course, the World Health Organization, as well as lots of the other UN agencies. I also cover the country of Switzerland and the kind of Alpine region generally. And this is not my first pandemic, so I feel a little bit supported in the fact that I covered the swine flu, H1N1, and we had SARS just when I first started in Geneva. We had that, so I feel a little bit supported that I know my way around the jargon of infection and measures and this kind of thing, so that's helped. But what I think this time last year I would never have expected is that almost every story that I have done this year has been related to this pandemic, almost every single one. So this week my key story is about skiing. Yeah, it's Switzerland, it's part of the economy, we like to do it, but it's about COVID and skiing. So that's the kind of thing. And I think, I won't talk about examples of misinformation right now, but I think one thing I'd be really interested to talk about is that this is a difficult topic for journalists, not just because we do have misinformation, disinformation, often that's pretty easy to spot, but there are really different perspectives on this issue as well. And it is our job as journalists to reflect them. We are not necessarily a mouthpiece for a government or a public health body. It is our job to reflect those perspectives. And I think that's something that we should think about quite seriously.
Yeah, I'd really like to come back to that. Yeah, so in the audience, I believe we have, just as on the panel, people who have kind of, in a sense, been there, done that, and that, have this head start that Imogen was just talking about in terms of covering pandemics, epidemics, global health crises. And we also have people who literally burst onto the scene, bringing to bear skills from other areas of reporting, like Asha. I really think of you very much when I think of that type of example of journalist. I know that you were previously not a health journalist, but I also know that you had an amazing story on Citizen TV very early on in the pandemic, which I watched and have shared many times. So I want to say, in calling your startup Debunked Media, what are you debunking currently? What are you debunking?
Well, yeah, good question. I think like many of us can attest to this. Something is happening on social media. When you watch documentaries on Netflix about, social dilemma, for example, you can see how misinformation and disinformation doesn't just happen by chance. Sometimes it's very well calculated. And a lot of times it is to serve political needs. And certainly that is the case in Kenya. So you have a lot of bots and politically sponsored accounts on Twitter, on Facebook, WhatsApp. It has become like, the leading spreader of misinformation, like it is in many of our countries. And what happened in the pandemic is that all these social media accounts that usually spread misinformation and disinformation on political events were the leaders in spreading coronavirus, but also just the layman, the ordinary man was, it just like amplified that space, the misinformation in that space. And I remember, I'm trained in investigative journalism. I cover security and terrorism and all the hardcore stuff that more often than not doesn't lead me to a hospital or a laboratory or to speak to a medical scientist. And I just remember being so confused myself. I'm a journalist. I know how to sift information and to know what could be wrong, what could be fake news. But I remember just getting so confused myself, looking at all these WhatsApp groups and thinking, surely someone must at least take a step back and try and just, make sense of everything that's coming in. Some of it, of course, outrightly, you could just tell as a journalist that this is definitely fake, but it was really difficult for me myself to just understand what is true and what isn't. So with Debunked Media, it's a thought that I had even before the pandemic, but the pandemic sort of solidified what I was thinking, that, you know, the future of information, especially on the internet space, will really need a lot of us to prioritize checking and to prioritize data and to prioritize speaking to experts. And that's why I wanted to create a platform that automatically tells you what it's about. You know, we don't just debunk, we don't just take a story and say, hey, this is fake and this is true. It's also to go deeper. But I wanted young people to feel like as soon as they see the word debunk, they know what it's about. So now we find people using it so often. Hey, can you just debunk this for us? Can you, you know, whatever it is, not even just the pandemic, even political events and other current affairs, can you debunk this? So the name was very deliberate to say that in this space that is so riddled and, you know, it's full of fake news, it's full of bots, it's full of misinformation, that once you see the brand, it automatically tells you that this is something that is trustworthy, because it was, you know, as a startup, you want to build credibility, you want to build trust. So the name automatically tells you, okay, this is something I can trust. Now let me pay attention.
And have your investigations led to a source of deliberate misinformation? I mean, around the world, for instance, you know, there's always speculation about who the originator of QAnon might be, you know, with such immense impact around the world. In Kenya, I know you've mentioned before that there are similar agents. Have you been able to unearth some of that?
I mean, we do when we do our investigations, because we have data scientists on the team who rely on open source investigative tools, which usually we would use such tools for deeper investigative stories around, let's say, corruption, or, you know, usually state actors that are involved with, you know, shady activities. But we do get information as to, you know, we get clues, we're able to connect the dots and say, okay, this could be the person behind it. But with our storytelling, that is not the priority. We prioritize, so what we do is we prioritize the truth. We prioritize the facts. And I think if anyone from the fact-checking world will tell you, it's usually very good to not repeat what the misinformation is, but to put facts right at the top, because also, you know, people have very little attention online. So as soon as you just say, this is what it is, and don't go into what the misinformation or who's behind it is. So while we can find that out and we know internally, we haven't really done a piece to say, these are the people who are spreading misinformation. What we do is to just debunk the issue and go straight to the facts.
Got you. So let's go to somebody from the fact-checking world. I mean, Hussein, that's what I had wanted to ask you about. Let me put two questions to you. What are the surprises and the big trends that you see? But then please help respond to this issue that Asha raised, which is a huge concern in terms of, you know, the fact that we always say that the facts aren't enough is the one, kind of really real principle of journalists. But also, what do you do when sometimes, you know, it kind of might seem almost from left field to just start saying something you in your head know you're correcting a fact? Should you sometimes have reference to that misinformation? Should you never? How do you approach it?
Yeah, actually, based on our work in Muharat Foundation, people have tendency to believe in fake news and misinformation more than the truth. So we have this challenge actually in our work. Also, we approach, as Asha said, we it's like not spread the fake news or misinformation. No, go to the right information and give it to the audience. But we have challenges in this. Actually, access to information, lack of access to information is one of the biggest challenges in our work. For example, it's like when we communicate with WHO, it's not a compliment, guys, but when we communicate them, we have the response after one day with a lot of or many studies and has their opinion. But when talk with Ministry of Health in Lebanon, it takes a lot of time to to response actually, and they use it as the answers for our questions as a propaganda. We do that. We work on this. We are ready for the pandemic. So it's like a propaganda because. In,
So you need to fact check their corrections.
yeah, because every in situation in Lebanon, every minister, especially minister of health, affiliated to one political party, so they use their work to for a propaganda for their political party, and this is difficult for us to approach this information.
How do you deal with that, Hussein? Because there's a particular problem in Lebanon and many other countries in the world.
Yeah, because we have a lack of trust in government body, so they don't work as a public servant. They work as a politicians and as a political party members. So we across the sources, Ida. Yeah, that's what we do. We take information from WHO, from FDA, from United States, and mix everything and talk to the people in some areas, especially rural area, about the misinformation or the truth that we should to conclusion. So yeah, we cross the sources to help us to get to the truth when we have complicated information, misinformation that we should solve. Yeah.
Can I ask you, I mean, sometimes simply correcting a fact doesn't necessarily result in news. Do you come across that kind of dilemma that, you know that some misinformation out there has been so potentially damaging that you feel you need to correct it, but this statement that you put out to correct it isn't particularly newsworthy? And yet you feel you should not repeat what the misinformation had been.
Yeah, sure. One of our strategies when we work on misinformation, that not repeat the fake news, because a lot of them, it's like give for example, self-medication. So take Panadol, take some herbs, take don't wear the mask. So it's very high risk misinformation, and also one of the misinformation is actually sarcastic, that one of the doctors in Rafiq Al Hariri hospital, that is a government hospital, said that coronavirus COVID-19 don't affect on Lebanese because our genetics is very strong comparing with European people. So it's very high risk information that could be give a severe damage for the public. So those what we tackle all basically that's high risk misinformation that we tackle. Yeah.
Thanks a lot. Sainath, how do you deal with that dilemma? I mean, a dilemma indeed. I mean, and I actually can't even imagine how you keep across all those many different languages and communities that you serve. You talked about minority blaming, minority shaming, and baiting. A lot of misinformation in there. Again, how do you ensure that you're sort of being responsible and that you're correcting misinformation, but at the same time create something that sort of has substance as news? Can't hear you.
Oh, I'm sorry. Can you hear me now?
Well, yes.
Just as we learned over the last 25, 30 years, that in coverage of health, you can't disconnect health from its socioeconomic determinants. In the same way, we can't disconnect coverage of the pandemic from the socio-political economic context in which it unfolds. Everybody is not affected the same way. And the thing is, it's not as if the media are, a bunch of innocents with a clean slate. Soon after the pandemic broke, at a time when the public needed journalism the most, when they needed journalists the most, the media here sacked 1,200 journalists and over 8,000 non-journalist media workers. And that's a huge underestimate. We don't even have the numbers because they're not going to write about it themselves. We only know from the unions and stuff. How do we deal with it? See, we understand at PARI, at People's Archive, we understand our limitations. We are not experts on pandemics, and we're not. What we try doing, and what we are one piece away from our 150th piece on life under lockdown, just on that issue, is to try telling the impact, looking at the impact of the pandemic through the lives of people, through the everyday lives of everyday people, trying to understand the impact on livelihoods, on economy, on agriculture, on tradition, on nomadic pastoralists, on fisher folk. And from there, you get an incredible body of information that drives us back to the old thing. I think in one line, COVID-19 has taught us something. It's done a brilliant, ugly, unsparing autopsy of who we are as a society, as media. It's given us every nerve, sinew, vein, artery, vessel, organ, bone is on display. It's who we are as a society on that table now. And we are trying to learn from that. I mean, India is one of the lowest spenders on health in the world. We're looking at what that means now for ordinary people, right? So it's a very hard lesson. The disinformation part of it, we try doing stories, not necessarily directly addressing something, though we debunk something that is false, but we show the stories of how. Oh, just one little example. One of the most undercovered things, in my opinion, is burials of dead people under the pandemic. Do you know how difficult it is in various parts of the world where there is such a stigma that mobs have attacked people coming to bury someone in their neighborhood who died of COVID, right? So we have done 2 months ago a story on a group of volunteers who are going around burying people on demand from those families and burying them according to their religious rituals. And incidentally, that whole volunteer group of 1,100 people are Muslims, which makes it even more interesting in our context.
And Martin, you're saying that in doing those types of stories in its own way, in an indirect way, it helps address misinformation because it shows how real, for instance, the pandemic is, how real the impacts of lockdowns are. And, a part of misinformation is saying that it isn't real, for example. Let us address those sort of components of misinformation that have been, I think WHO in the framing of this conference, and from what we all read, we know that there is talk of an infodemic, where it's the sheer overabundance of information, albeit factual, sort of the speed at which both the virus and then the science that followed, and then the lockdowns that followed, and the perhaps state overreach that followed. I mean, there's just a lot of information to take in. We all can identify with that. Then that sector of misinformation that is about an inadvertent, about misunderstandings, about the fact that it is complex, just kind of trying to figure it out, trying to find a solution, trying to do good, sometimes even trying to explain where life's difficult to comprehend. And then, of course, the type of misinformation that is termed disinformation, where there is a deliberate attempt and sometimes even automated attempt to galvanize support for a disinformation strand, if you like. So, Imogen, you mentioned something that sort of brings me back to the infodemic, the overabundance of information. In other words, I think you were suggesting that sometimes there are viewpoints which are perhaps equally valid or both valid, and that just in covering those and in covering the sheer volume of unfolding science, there's a challenge. There's a challenge that may lead to misinformation. Could you talk a bit more about that?
Yeah, sure. I mean, because I think, from where I sit, just to pick up a little bit on the misinformation, I haven't, as a journalist, had to focus quite so much on that. I mean, the BBC, we also have a fact checkers, and we have debunked for example, the stuff about hydroxychloroquine and this kind of thing. But I think one of the things that with the massive information out there is that this is a very new and really quite seismic experience for the entire planet, which we weren't prepared for, as we know. And people want answers, and they want them really fast. And you know, when I first started reporting on this, basically as soon as the WHO said we've had notification of a new virus in China, I do a lot of live work, TV and radio lives, and consistently being asked by the presenter back in London, so what is this? And there really is a point as journalists where we have to say, we don't have that answer, because the scientists don't have that answer. This is new, and we are going to have to be patient. And I think even now, a year on, we also have to say honestly, and this brings me to the perspectives, that we don't know everything about this disease. We actually don't know what the mortality rate is, because we have no idea how many people have been infected and had it and didn't know they have it. This is data crunching that's going to take a decade, I think. And we should maybe, think that maybe in a few more years we'll know, my goodness, it was good that we did all that and we saved a lot of lives. It may be that we are in a global recession and we're thinking, oh my God, why did we do that? That is still possible. I think maybe the WHO won't like me saying this, but I think that is, both of those verdicts are still possible. And that's where I come to the perspectives, because, I talked to a lot of doctors covering this story. And most of the doctors I know who treat patients really have a different perspective about the measures that have been taken. They see the whole patient or their whole village as a patient. And they talk about the old lady who can't have any visitors, or the young guy who's lost his job and now has mental health problems. And of course, you can argue that, particularly in Europe, maybe it's because they were so unprepared and took measures so late that we had to have these really strict measures. But still, another doctor said to me, it's the West's problem. We just don't think anybody should ever die of anything. It sounds really harsh, but it is a perspective, and it's from a health professional's point of view. And then, of course, we have the epidemiologists who've been so good at tracking the data as fast as it comes in and sounding the alarm bells. And they say, look, it's really rising. You need a lockdown right now. But the village doctor will say they're not looking at people, they're looking at dots on a graph. And both of those perspectives, I think, are important for journalists to reflect. There isn't one right answer to this. And God knows we have to learn from it. We have to learn from this, because, as you said, there will be another pandemic.
Yeah, it's a wicked problem. Neither the virus itself nor the mitigations suit us very well. It's wicked, and the solutions are unfolding as what we're learning about the virus is unfolding. But however, what I wanted to ask you about that is, so do you sometimes find that in trying to find that sort of so-called journalistic balancing those viewpoints, if you like, that you, in the same way, might sometimes perhaps inadvertently contribute to misinformation simply because you don't know, or because it's difficult to always say we don't know?
I hope not. I really hope not. There's another angle to it, as Sainat talked about shaming, which I have seen a tendency to do in journalists in Europe. Spot a crowd of people, take a picture, put it out on Twitter. And frankly, I've tried to avoid that, because I honestly think most people have tried incredibly hard to follow what are quite unnatural lifestyles for them over almost a year now, or 9 months. And I'm not convinced, if we have to also play a role, which we do in a kind of public health effort, even though people have disagreements about how exactly that should be implemented. But if we have to play our public information role, which we do, then shaming people is not part of it. And that I do think, I regret that has happened with some journalists. We've seen the stuff in Holland, the people who danced before their lockdown. We've just seen here in Switzerland pictures of the government minister with a small crowd of people around him because it was his 70th birthday. I just don't think that's helpful at all in this situation.
Thanks. What's your perspective on that, Asha, on this kind of, I guess, this compulsion we all feel to kind of have a public health message, but at the same time to also kind of really be involved in truth telling, particularly with, sort of with this infodemic and misinformation framework in mind, obviously.
Yeah, I mean, I do agree with Imogen about, the shaming, for example. I was just thinking about this when all panelists were speaking. The perspective, the challenges have been very different covering from an African country, because I think you remember at the very onset of the pandemic, the prediction was that Africa was going to bear the brunt of the pandemic. There were predictions that perhaps the health systems would not be able to handle the numbers. The challenge for me as a journalist has actually been to speak to the audience and to show the real impact of this pandemic, because the perception, and which I don't think it's entirely wrong for the general public to feel this way, is that it's not a very big problem for African countries. So the challenge has been to actually show that this is a crisis for us too. Last week, I was in Cote d'Ivoire. In Cote d'Ivoire, they just had their election. One of the first things that I noticed when I got to the airport and I was driving to my hotel was that people are not wearing masks. So obviously, in countries like Kenya, mask wearing is compulsory. It's, government has now taken it really seriously, but there it's not a big deal. Nobody's wearing masks on the streets. And when I asked about it, I asked about the COVID numbers. Obviously, the data is not very reliable. People say we were wearing masks until the president had to show up at this event, and he had to sort of like have this gesture with a fellow politician. And from that event, masks were not compulsory, because he basically said it's okay, we can hug and we can greet each other without masks. Coronavirus is not a problem here. When you have that sort of perception in African countries, and it certainly has been so in Kenya, for example, that COVID is not such a big problem, then passing on that information is much harder. And I feel like that has been like the biggest challenge. I don't know about my colleagues from the other regions. That's been the biggest challenge, and it remains the biggest challenge for me, even as the editor at Debunked Media, where you're having doctors calling you and saying, look, we have a big problem. Hospitals are full. We have to turn patients away. We know we're turning patients away who are possibly going to die. But on the flip side, how politicians are portraying the problem is that it's not such a big problem. Not too many people are dying. So that balance has been quite difficult. So I have understood from this end, when I've seen some of my colleagues take on Twitter and call out people for having big gatherings, or for not wearing masks in public, because that's also been a thing. So I do understand when people do that, because that sort of like hot and cold messaging has really, really affected even our coverage, and sometimes makes our work look like it's not important. So it's just a flip side, like another observation from this part of the world. So the examples that Imogen has given are really, like, certainly if someone was having a very small gathering, it's not right to put, their photos on Twitter. But on the flip side, on this side, the president, for example, went to have a political rally about the referendum in one of the big cities in Kenya, and had a big crowd. And shortly after his visit, of course, he was wearing a mask, but the vast majority of the crowd were not wearing masks. There was no social distancing. Immediately after his visits, the coronavirus numbers shot up in that city. So how we approach that story is actually, we stepped away from the numbers, and we told a story of a young person in Kisumu. We had him write like a personal essay of how he thinks he got coronavirus. So it turns out he went to this event by the president, and he was there without a mask. And after the political rally, he had COVID and he almost died, had a near-death experience with the disease. So that's how we did the story. And it's a very simple read with illustrations. So I feel for me, the challenge has really been, how do I make this story important? Even now, 9 months after, we started covering it, how do I make it important and top of mind for audience members in a region where people feel like it's not really been a big problem for us?
And I think we've actually seen also how mainstream media is being blamed and shamed itself. I mean, in those narratives on social media, we know about how much of this has been driven from the US president in the past, still, but also how, I mean, I certainly see this on social media feeds, how mainstream media is really being blamed for misinformation when it is in fact actually trying to put forward responsible information that seems implausible or improbable to the audience. Does anybody else have a problem with that particular challenge? Kind of being perceived to be pushing this sort of responsible line, the line that the public doesn't want to believe. So anyway, let me also ask you, remember we said all can ask questions to anybody. So I wonder if Hassan, Asha, Imogen, and Sainath, if you have questions for your colleagues on the panel, something you wanted to know in particular about their setting or their perspectives on misinformation.
I'm just thinking, when the 4 or 5 of us go back to our work,
yeah,
what plans do we have for stories on the impact of the pandemic, and what the new stages of knowledge are about vaccines, about anything? Do you have any stories planned out? Any kind of coverage planned out for that? I'd love to know and learn.
Well, I will probably do something as a reflect back on the 12 months, because in January I will do something, because I have many interviews and I've collected different things from the WHO and other people over the year. And I hope it will be quite an illuminating story, radio story, about how our perspectives have evolved over these 12 months, because I think even people inside the WHO would not have expected necessarily that we would still be sitting here. I'm in my home office, you guys are probably all in your home offices, in December 2020. And if they had expected it, they were probably wise not to tell us, because it would have been too difficult. So that I'm going to work on, and the vaccine rollout, which hopefully is coming.
Yeah, I think like Imogen said, it's like a shock for us when the pandemic goes in Lebanon. It's like a lot of information, misinformation, disinformation. So in the first phase, we deal with not rumors giggling with water and salt to help you to prevent from to coronavirus. But in every phase, when we got development in that, we sense that people have some awareness about that. So it's like helpful for us to concentrate on the deep information or disinformation that cause severe damage for people. So I think it's different when we get face to face. Now we have the vaccine and a lot of misinformation that Pfizer vaccine or Moderna vaccine, it's killing people, not curing people. So it's like different stages with misinformation, and we deal with them as a phases. So that's for us.
We want to look at the vaccine story specifically in phases, perhaps.
Yeah, I think it's very important to now, and as I said, in vaccine phases. So yeah, we get one by one to talk about the vaccines and the benefits of them, and all the advantages and disadvantages for now. Yeah, now we're working on this phase.
No, so as a concrete plan, maybe, yeah, I think that from Sinath's question, a concrete plan I feel could be to look at the vaccine story in its complexity and to look at the fact that, for instance, there's science, there is access to the vaccine, there is the rollout, the logistics of that. There are the human rights aspect, the demographics, the decisions about who gets a vaccine. And of course, there's uptake, and uptake really links very closely to our misinformation subject. You know, all of the misinformation about vaccines is, perhaps we should spend a few more moments talking about the vaccine specifically. But any more responses to Sinath's question before we get to, let's conclude with vaccines, because it's the story going forward.
Well, I'd like to say what we are thinking of doing, which
Yes.
is I think we are embarking on a series shortly of what you might call, and what several activists in the world call, health justice. You know, health justice, stories under health justice, I think, are what we seriously need to be looking at, apart from recording first person accounts of migrants on the Great Long Marches. That's our plan. Yeah.
I think for us as well, the vaccine story is big. But there's another story which can also tie to perhaps like how Kenyans and other Africans will take up vaccines. You know, vaccine is a very controversial subject in this part of the world. People know that even when we were discussing, you know, the tetanus vaccine for mothers, for example, it was very controversial, and there was a bit of backlash from the church as well. So it will be interesting to see that uptake, but also access to vaccines for Kenyans, for other Africans. But I think something that's very interesting for me going forward, maybe some people are very tired of looking at the numbers, the data, but we haven't had access to the data. But I'm very curious to see what the data tells us. For instance, we don't have very good documentation on things like pre-existing conditions, you know, how many people suffer from certain diseases. And I think that, you know, already some of the data I've seen shows us like the regions that are affected by certain diseases, the people who really bore the brunt of the pandemic, the victims of the pandemic in Kenya. I think the data is going to reveal a lot more about healthcare in this part of the world. And so I'm very curious to see who got COVID, who survived it, who died from COVID, you know, what are the age groups? There's a perception that young Africans were not very affected by coronavirus. But it's also that young Africans, not very many know if they have a pre-existing condition. And COVID has sort of revealed that for some people.
Wonderful, thank you. Anybody else with a question for colleagues?
Also, I have a question to Asha, because their work is amazing. I want to ask you about the challenges about the access to information in Kenya and Africa, because you have a lot of investigation reports. What the challenges basically? Because in Lebanon we have a lot of challenges due to this topic. So I want to learn about Africa and Kenya.
Thanks, Hussein. I think Kenya, we've been lucky. Our neighbor Tanzania, for example, has not revealed any data at all on the pandemic to not just the members of the public, to WHO, to international organizations. So you cannot find any data in Tanzania. Certainly you see like countries like Cote d'Ivoire, for example, you can't find reliable data either. Kenya, we've been lucky because there's been constant updates. So every day we get an update on, just like I would assume in Lebanon, I don't know if that happens, but we haven't really gotten to the granular data. I'm not sure when government will give access to that data, but there's definitely been, you know, there's been a handling of the data where, you know, it's not open. It's definitely not open. And you have to almost have like very deep sources within the Ministry of Health to get the granular data on COVID-19. In some frustration that I had, because before I founded Debunk, I was at Citizen TV, which is the most watched TV station. I did quite a bit of reporting on COVID-19. I noticed that also experts, there was a bit of control on which experts can speak to media, and especially if if their expertise was not in line with government narrative, there was a bit of hesitance for doctors, epidemiologists, and lab technicians to speak to the media, and that kind of gave it was very frustrating, because it meant that there was one specific narrative that was being pushed, and that meant you don't have complete access to the information that you need to do like very balanced reporting on the pandemic.
Thank you.
Mm-hmm.
Any other questions? Questions by journalists to other journalists?
I'm sorry, I'm curious. So I will ask another question to Sania. In rural areas in India, you have a lot of languages, different cultures. So how they react to the infodemic? If they have a certain reaction to this pandemic and infodemic.
Well, it's as varied and diverse as those people. We have, in rural India, you have 780 living languages, 6 of them spoken by over 50 million, 4 of them spoken by over 80 million, and then you have a lot of little languages of tribal peoples. The thing is, one of the things that Asha mentioned is a problem in some areas where they think this really isn't a big deal. Yeah. In other areas where the migrants have returned, they thought it wasn't a big deal, and about a month or 2 later, they're finding out that maybe it is a big deal. So the problem there is not only how they react, but their access to any kind of halfway decent medical attention. Okay. The different rounds of the National Sample Survey each 10 years on health show us that in the last 20 years, the number of Indians not seeking medical help for purely financial reasons has more than doubled. Okay. So it's in some places, there is fear to the point of panic, where people have put up barbed wire outside their villages to see that the returning migrants go and live in the fields for 14 days before they let them in. In other places, there is a totally blasé attitude towards it, saying, this isn't about us. So it's very varied. And the other thing is that our numbers are largely extremely dicey and suspect. Even the kind of tests we do, whether we are doing what percentage of rapid antigen, what percentage of RT-PCR, it's really horrible, except 1 or 2 states like Kerala, which actually maintain very good records and were doing tracking and tracing long before the country declared a pandemic. So it's varied.
Is it this gap? Is it, because I think that's sort of what has been puzzling many of us, I'm sure, I speak for so many, is that, how is it that people believe the things they believe? Some of it just seems completely, we as journalists know we can't say it, but I think we sometimes think, how can this some person think it? And of course, the next moment we have to step into, what does that mean for us? What does it mean for our work? It sounds like if there's an absence of services, there must be an absence of information. Of course, you serve a lot of that information need. Can I ask you anybody about that? I mean, what has been your kind of strategy in your head to, in terms of a response when you feel that you almost cannot comprehend why somebody believes what they believe?
And before you answer, we're going to have to wrap up this session fairly soon. Maybe just some quick answers.
Yeah, thanks, Melinda. Thanks, Mindy.
Facts presented in a kind and respectful way. I mean, you don't get anywhere with somebody by saying, oh, what a fool you are, you're wrong. I mean, it's saying, well, did you see that the WHO, and they know their stuff, said this and this? But I mean, I'll make these my last comments because I have 2 things I wanted to say before we finish. What Asha said about data, that is just so important. You have difficulty getting data. I have some difficulty getting data in Switzerland. I get part of it because they don't have everything. So we have figure that says the average age of somebody who's died of COVID in Switzerland, the average age is 86. That's what I read somewhere. But it's a dangerous figure to put out there. What are the young people going to think who've lost their jobs, who can't go to university, who can't go to school? And you see that, then why should I bother? But because we don't have all the data yet, it's dangerous to take some data in isolation. And it's going to take years, I think, to really get a picture of exactly what happened. And then with vaccines, I think that's our next big challenge as journalists, because we know there's vaccine skepticism. We've had a spike in measles here in Europe. And the pharmaceutical companies, I think, also need to think very hard. We had one of the three, I won't name it, but one of the three who say they're successful put out stuff saying we're successful with very little data released. And people are not stupid, you know. The people who are skeptical about vaccines will find the gaps in information and milk it. And so it's going to be a challenge, I think, to start this vaccination and gain trust and not spread doubt, but still report the fact that maybe this one we don't have enough data yet.
Complex story, yeah.
Yes.
Just quickly, our strategy has been, because we are competing on social media, I told you, and for young people who are just scrolling and they can go past, you know, hey, look at this fact about vaccines or about COVID, or, you know, this is the truth about this. What we do is just we package it very lightly. So we use a lot of, you know, graphics and illustrations. So it doesn't really look like it's in your face scientific information, but we pack quite a bit of scientific information in it. We also, it's, you know, quite presenter-led and very conversational. So I think what Imogen said is right. It's just, you know, you're very empathetic in how you also convey the messaging. It's not that you don't know this, you need to know this. It's that, look, this is really important information, and maybe sit down and, you know, kind of like, let's unpack this for you. That's been our strategy going forward, because I know I've seen quite a number of questions about vaccines. It's going to be very challenging for African journalists to cover the vaccine story, mainly because the backlash usually comes from other leaders, like religious leaders, who are very well trusted within our communities. So I think it's a matter of how do we include such voices in our reporting that is factual reporting. So how do we also show that this is information that your leaders as well, you know, can attest to? This is information that, you know, it's a challenge that's affecting all of us. So perhaps bringing in community leaders, religious leaders to the conversation, so that it doesn't become too scientific, because we're a very narrative-driven society, and a society that really listens to 60 hours. Community leaders. So it's taking that strategy as well going forward with the vaccine story.
So thinking always of what your audience needs to hear, wants to hear.
Exactly.
Any time, I hope there's time for closing comments from Hussein and Sana.
Yeah, for us, our strategy is based on, like Asha said, a lot of infographics and the videos. It's to give some information as simple as we can. And for the journalists, we do a media bulletin. We have a lot of rumors, but we pick 2 or 3 of those and put it in a media bulletin, and put some tips for the journalist, some contacts that can reliable for them, and some sources can work on that to take truth information about the rumors or the infodemic. Yeah.
Wonderful. Sana.
If I understood your question, Aida, it was also about how do we cope or deal with the beliefs that people have.
Yes.
I think that what Imogen said is very important there. It's, you know, your first thing is to avoid condescension and mocking of someone's beliefs. I believe, and by the way, I believe that a lot of journalists cling on to superstitions and shibboleths about their own profession, which could very well, could do with a lot of debunking. So I think that by telling the story through their life story, you will be contextualizing those beliefs and allowing your reader or viewer to understand that that the beliefs are neither to be mocked nor taken at face value. So, I mean, that's how we would approach it.
Thank you so much. I believe that must be the end. There have been wonderful questions. I hope there's an opportunity for them to also be answered. But I think one of the key ones that I'm noticing in the chats, how do we get outside of our echo chambers? I think a lot of you spoke about thinking of the audience asking questions. Thank you so much. That has been so illuminating, very exciting. Back to you, Mindy.
Thanks, Sita. Thank you, Asha. Thank you, Imogen, Hussein, and Sainath. Really insightful discussion and very interesting. Thank you for going on that adventure with us. Just in my closing remarks, I want to ask the other individuals here to turn on their cameras. This is sort of the background team that's put this program together. Before we say goodbye for right now, I just want to let you know that we're going to move on next to some invitation only, unfortunately, breakout sessions, cafes, so to speak, where a few of you in the audience have been asked to join us for the next hour to really unpack this and hash out the details on what we've learned and what the challenges have been in the infodemic. We invite you again to join us next week, same time, different link on December 9th, where we really move on and start talking about the solutions and our commitment and the things that we can do together to address the next infodemic. I know there was one comment or question in the chat room that said, well, will WHO come up with a checklist for countries to manage infodemic? I just want to let you know that WHO has been working in this area for more than a decade under the international health regulations. We've helped countries build their capacity to address emergency risk communications and community engagement. The term infodemic has been a new one that we've introduced with COVID-19 because information is just changing so rapidly and flying around so rapidly. This is a new term and a new response, but using a lot of the same things that we've talked about in the past: transparency, trust, showing respect, showing empathy, the things that were discussed today. So, for taking the time. I hope that we see you at sessions. Again, thank you to all of the presenters, and we will see you next. Thanks. Bye-bye.
Thank you.
Bye-bye.